Ladies and gentlemen, good afternoon and welcome to UMFST International. Today we are honored to have two international guests together with us. From the University of Miami's Miller School of Medicine, Professor Miguel Reyes Mujica and Associate Professor Claudia Maria Salgado. So welcome to both of you.
Thank you. Diana, it's an honor to be here.
Thank you.
Thank you.
I would like to start with a question for you first. So, Professor Reyes, your work in pediatric pathology has been widely celebrated. Could you share with us what led you to specialize in this field?
Well, first, I decided to go into pathology when a mentor of mine invited me to join his research lab, Dr. Ruy Pérez Tamayo in Mexico City. And then his group was one of the most important groups of pathology in Latin America. And I started working in the National Institute of Pediatrics, trained there for a year, and then rotated through other hospitals and returned to be a pediatric pathologist there. But I wanted to explore the world. So he put me in touch with Dr. González Crucí in Northwestern University. Now it's called Lurie Children's Hospital. And I went there for a year, and that has been 34 years ago. So I stayed there for 4 years and continued working in pediatric pathology, moved to other places, and have continued working on pediatric pathology ever since.
So actually your work on pediatric tumors and neural crest disorders has had a significant impact. Could you share some insights with us?
Sure. The first publication I ever had was on neuroblastoma. It was a review paper. And then I discovered the neural crests. And the neural crest is a temporary population of migrating, professional migrants, I call them, cells that come from the neuroectoderm and develop into many different types of tissues. They are the closest cell to a stem cell, and they produce melanocytes or endocrine cells or neurons in the peripheral nervous system. Our face entirely is made out of neural crest cells mostly. And so when I discovered that, it caught my passion. So I started having an experimental laboratory for researching neural crest disorders, and then continued studying congenital melanocytic lesions, pediatric tumors of many different types, which are frequently derived from the neural crests. And that's how I became involved in pediatric cancer.
It's very impressive. Professor Salgado, could you tell us about the key moments in your career and what actually brought you to where you are today?
Thank you, Diana. It's a very pleasure to be here. So for me, pathology was not my first choice. It was a discoverer. So I started my life in Brazil, long time back, as a pediatrician. That's my passion.
Beautiful.
And then I trained as a pediatric pathology, and I was a professor of pediatrics for a very long time. So what brought me to pathology was when I moved to the US, I started working in a research lab. And I found that pathology, you have many different ways to understand better the disease. And that was my passion to pathology. And I was telling the students today that all the disease that I saw in the books that I couldn't see in my professional life as a pediatrician, I can see as a pediatric pathology. And to leave this area that we are understanding better the disease, the molecular basis of the disease, and finding treatments for this, the same disease that I saw before, having target treatment is amazing, is fascinating. And that's what brings me to the point that is in my life now, discovering every day new things with new technologies that we have nowadays. So it's amazing.
Actually, you understood better what you saw before as a clinician, if I can say that.
For sure. And I can see all the disease. I can give you many examples. We study many times glycogen storage disorders. And in pathology, I have the opportunity not only to see this, but to discover and to confirm the metabolic and genetic basis of the disease and help the clinical team and the patient in much better way. So it's fascinating.
It's amazing.
It's really fascinating.
Yes. Both of you represent actually an institution with a strong global presence. So what advice would you give to universities like ours that are wishing to expand their international footprint, if I can say?
This is an amazing opportunity for all institutions to look. I think Miami is in the same situation. Miami is, and that's the reason that we are there actually, because it's in an open door to the United States. It's a very open city and a very open university. And like you guys here are trying to open mind for our students, bring new ideas, new ways to think, new ways to see the same problem. And this, I think for our students, it will be much better. And for the students of this university that I'm very impressive, is very important.
In my opinion, this is a fantastic place to learn. Studying pathology is not easy. Pathology is the study of life under abnormal conditions. But you have a wider, complete, global approach to pathology. I have seen, attending these conferences, neonatologists, pediatricians, radiologists, medical students, forensic pathologists, and I cannot continue because it will take us an hour. So this richness of interest that your program is eliciting in other people is exemplary. And I think that you are set to move to the next level in terms of teaching medicine, teaching pathology, and teaching academic medicine, which is the most important passion that I have, because in my opinion, the study of medicine is to try to develop not opinions, but evidence, which is what should be the basis of all actions. So congratulations on having a wonderful university.
Thank you very much. And of course, as we near the end of our discussion, I would like to ask what message you would like to share with our students and with us, of course.
Well, as a message is to not put limits on yourself, to follow your mind, to follow your ideas, to imagine what would you like to do and pursue it with no limits, with no fear about what may or may not happen. Just follow it. Certain things look very difficult, but difficult things just take more effort. So that's my advice, to pursue your passion and not give consideration to any potential obstacles, because you should be able to circumvent them.
Thank you very much.
For me, learn every day. So I think that's what moves. I think everybody that does medicine in life have to be able to learn every day, learn with our own mistakes, learn from our friends, make new friends. I think medicine gives me everything in my life, include my friends and new friends that I make every day, give me the opportunity to learn every day. And this is amazing. I cannot imagine a professional more beautiful than that. Maybe that's because I am a physician in a broad spectrum, like from the clinical team to the pathology. You have to be open and enjoy to learn every day.
Thank you so much for sharing your experiences and insights with us. And we hope you will accept our next invitations.
Thank you very much. It has been an honor to be here.
Thank you.
Thank you.
So to our audience, thank you for watching us, and stay tuned for more.